Lee Sanders. I'm one of the consultants on London's Air Ambulance, and I've been involved for just coming up for 12 years. As one of the consultants on London's Air Ambulance, my role is primarily to treat the patients that we see. So I go out as part of a team with a paramedic, sometimes with two paramedics or with another doctor. But our primary role and my role in that is to make sure that we deliver the best care to all the patients that we go to. My typical day will involve treating patients alongside one of my paramedic colleagues. It may be supervising a new doctor who's in training. It might involve signing off a doctor who's at the end of their training month and comes and has an assessment to decide whether they're ready to fly solo, as we call it. We often do a moulage or a run through of a simulated case to keep us both clinically current, but also to help with our team working. And then we have case reviews. So we'll go through all the cases for the last 24 hours. So during this pandemic, our role hasn't changed. So we're still here for London and we're still here for the trauma cases that occur within London. So there are a few things that have been quite different about how we operate in this time. We've always been mindful that trauma will continue. And although the case mix and the caseload may have gone down slightly during the first phases of lockdown, it's already starting to pick up again. And it's really important that the care of individual trauma patients isn't compromised in any way by the fact that we're in the middle of a pandemic. So London's had an amazing response as an entire city, and the way in which we've stood up intensive care beds and we've reorganised hospitals and services has been absolutely amazing. And that's given us the capacity to continue, quite rightly, treating everybody else who's got an emergency at the same time. So trauma patients have been receiving the same level of excellent care. My role outside London's Air Ambulance is as an emergency medicine consultant at Imperial. And I'm also what's called the clinical director, which means I'm the lead consultant for both the Charing Cross and St Mary's emergency departments. So at the beginning of this, there was a big reconfiguration of services that we had to undertake in a relatively short period of time. And we had to think about how we were going to have a pathway for respiratory disease and a pathway for non-respiratory disease, and how we would try and keep those separate. And there was a huge amount of logistical work to be done. So really simple things like how our staff would get into work, where they would park, how they'd get food. Because if you recall, at the beginning of this, all of those things were really uncertain. None of us could get any shopping. All the restaurants closed down, all the food outlets closed down. And so things took a little bit of a while to get up and running. And then the biggest thing that I feel my role is involved is dealing with PPE, what we need, how we need it, when we need it. And I think the main thing has been about morale and keeping people who are understandably worried and anxious about all of this unknown, and the wider global uncertainty and the sort of life uncertainty that has happened with this has affected everyone in the NHS just the same as it's affected everybody who's at home and worried about these things. It's also been, I think, quite a psychological challenge. I guess what I would say is that I've seen throughout this pandemic, trauma continues, and trauma continues to be a disease that can affect anyone at any time of day, at any point in their life. And there are lots of things that we can do to change people's actual outcomes for people, so whether they survive or not, but also the way in which they get treated and giving them, I guess, the best chance of a sort of healthy lifestyle afterwards. So I would say that supporting the charity at this time is still really, really important. So one of the things that you see in this job is that your life can be changed in an instant, and you can leave for work or school or whatever in the morning and not come home. And we've always known that doing this job and doing emergency medicine, and those things are no different now. So the way in which we approach things shouldn't really be any different. It should be that every day we should live each day the best we can under whatever circumstances they are. So I guess I would just really encourage people, for their own mental health and well-being, to try and just enjoy the things that we've been able to enjoy through this, which are very different from the things that we enjoyed before, and to try not to worry too much about the bigger picture, difficult as it is, because that's the same way in which a lot of us approached things before this.